Welcome, and thank you for joining our presentation, The Stages of Escalation, What Do They Look Like, and How Can I Intervene? So far in this course, you've gone over the definitions of misbehavior and emotional outburst. You've looked at the characteristics of each, and you've learned to differentiate between the two. While it's helpful to know the difference between misbehavior and emotional outbursts, it's good to look at how the student's feeling and know what stage of escalation this individual might be in. During this presentation, we'll go over the things mentioned in the title. The objectives will be as follows. We're going to look at the stages of escalation that an individual might go through while in crisis mode or while escalating. Meanwhile, we'll be looking at the signs of escalating behavior that an individual might look for when they are dealing with a student who is escalating. And finally, we'll be looking at some intervention strategies that could be used to deal with individuals who are going through these stages of escalation. If you're a person who researches behavior topics such as escalation and de-escalation, or behavior models in general, you're going to find that there are several different models out there. But when it comes down to it, these models are very, very similar in very many ways. Things that they have in common in particular, such as aggression can be unpredictable. We all know that. We've experienced it, we've seen it. We know that aggression can look many different ways, and we can't always tell what the individual is going to do when they're acting out. This is why it's good to know what level of behavior or stage of escalation an individual is in. Another commonality among many of these models is that they all say that a student may move quickly from slightly agitated to full-scale aggression. So an individual might go from a trigger stage to full-out aggression in no time. They don't have to go through these steps in order. And in general, if we're talking about non-crisis thinking versus crisis thinking, we would generally put these first three stages of this model, this particular model, and maybe the last stage of this model into the category of non-crisis thinking, where these individuals are more logical, they're more abstract, they're more reasonable. These are the individuals you can reason with. It might take a little more time to reason as they go up the stages. However, these individuals are easier to talk with, to reason with, to get through to. Now, when they reach the stage of crisis thinking, these are the individuals probably around steps 4 or 5. Their behavior is starting to become more irrational. Their thinking is more illogical, more concrete. You need to really talk to these individuals or back off in some cases. And these individuals are very unfocused when they're in these stages of acceleration. And then as they're coming down from their peak stage, they're still kind of iffy. They're still in that stage where they could go either way. They could escalate again to the peak stage or de-escalate, depending on how we handle it. Now we're going to take that model of the stages of escalation and break it down. Let's first look at this diagram. Notice on the left side, we have behavior intensity, going from low to high, of course. And our first stage starts with the least intense behavior that you might see. This is the behavior that we prefer to see. It's the calm stage. And it's just that. This is the behavior that an individual who is comfortable, who is content, is going to show. According to Colvin and Sugai, the calm individual is one who is relatively cooperative. The calm student is going to readily accept corrective feedback that you might have for them. They're going to follow your directives. They're going to set personal goals. They're going to ignore those distractions that happen during class. And they're going to gladly accept that positive feedback we give them as a motivator for positive behavior. It goes without saying that we want individuals to stay in the calm stage. And so we focus on prevention. We are all aware that we have some students who require a bit more attention than the others. And so we do our best to look at what things might set a student off. Okay, so we assess their problem behaviors. We look at what possible triggers might this student have. Has anything happened in the past that set this student off? What things do we need to avoid? Okay, so we look at that. And then we look at what does the student try to get from his behavior when he or she is acting out. And finally, we look at this individual's academic and behavioral learning history. Does this individual have a history of acting out in school? Does this individual have a history of learning problems? Do they possibly act out maybe to escape an assignment or because he or she doesn't understand? These are things we need to consider. So in exercising prevention, we want to take the focus off the negative. We want to use positive reinforcement as much as possible. Focus on the positive rather than the negative. And here's one. We want to teach social skills. It's safe to say that all kids do not have the same social skills set. And this could be for a number of reasons, including upbringing, environment, life experience, and even disabilities. Skills such as problem solving, relaxation strategies, and self-management seem to come naturally to some people, whereas it doesn't come so naturally to others, especially those with disabilities. Those who don't have these social skills often need to be taught. Finally, maybe most important of all, we want to communicate positive expectations, especially to those who maybe don't get it all the time. For example, if an individual is running down the hall, instead of saying, "Don't run," we might say, "Please walk." We need to make an effort to tell students what we want them to do, rather than what we don't want them to do. The second stage of this escalation model is called the trigger stage. During this trigger stage, a student may experience unresolved conflicts which cause his or her behavior to escalate. Some students' triggers may be the result of repeated failures in class, frequent corrections by the teacher giving that student unwanted attention, interpersonal conflicts dealing with things that they just don't know how to deal with, perhaps the anxiety of meeting timelines is too much for a student to handle, or finally, low rates of positive reinforcement, where an individual is constantly being told what he or she is doing wrong, as opposed to recognizing or being recognized for what he or she is doing right. All of these triggers most likely bring on some kind of anxiety with each student. We need to keep in mind that all students do not deal with anxiety in the same way. Some deal with it better than others. Therefore, when considering triggers, we want to focus on prevention and possibly even redirection. When dealing with an individual who's been set off by some kind of trigger, we need to figure out why that individual is acting out and how we are going to respond. For example, if an individual with autism covers his ears, this could be a sensitivity to loud noises or buzzing lights. These are things we need to consider when we're dealing with individuals. In such cases, we might need to remove the student from that room or make other arrangements so that the individual is more comfortable. We need to increase students' opportunities for success. And let's face it, we don't like to do things that we're not good at, or we don't like to repeat things where we don't experience success. The same holds true for students. If they aren't experiencing success, they're less likely to try hard, or they're just going to start giving up. We need to provide students with small opportunities of success and build upon that. Finally, we need to reinforce anything that's been taught, whether it's behavior or academic. Let students know that they're doing right. Stage 3 of the escalation model is the agitation stage. During this stage, an individual will become increasingly unfocused or upset. And notice on the model that the behavior intensity is starting to increase with agitation. During the agitation stage, you'll see greater anxiety than you saw with the trigger stage. Also, during the agitation stage, this individual has an increase in unfocused behavior. Such behavior might include being off task or unfocused with his work, frequently starting or stopping tasks, taking a stretch break in between, or looking around, looking out the window, getting out of your seat, talking with others, or becoming socially withdrawn, maybe putting their head down in class. As we said earlier, anxiety increases with agitation, and therefore, intervention at this stage is focused on reducing anxiety. Again, we need to consider why an individual is acting out. What is the function? Is it intentional? Is it not intentional? If necessary, we need to make structural or environmental modifications in order to reduce anxiety. And keep in mind, we haven't lost this student yet. We need to provide this student with reasonable options and choices to try to figure out how we can reduce their anxiety. Be calm, be rational, say things that will make the student want to improve his or her behavior, and try to keep it positive so the student's behavior doesn't escalate. Stage 4 of the escalation model is the acceleration stage. At this stage, a student is becoming even more increasingly unfocused and upset. Here, a student becomes defensive and starts to lose rationality. Under these conditions, it becomes increasingly more difficult to rationalize with this individual, to talk to this individual. This is actually the stage when the student starts to tune you out. This is also the stage when they'll start to challenge you as an authority figure. They'll refuse to comply. The overall intensity of their behavior in general is just higher. They might have emotional outbursts. They might verbally vent. They might tell you that they hate you, they hate school, they hate this, they hate that. They're sick of you. They might threaten you. They might try to intimidate you. They start to get personal. They attack you personally. And they try to get you into a power struggle. I should also include that when an individual is in the acceleration stage, he or she is entering crisis mode. Therefore, we focus our intervention on safety. We need to remember that this individual is starting to lose rationality, and therefore, as this individual's behavior escalates, he or she begins to lose self-control. And at this point, it's very likely that this individual is going to fully escalate. So keeping in mind that safety is our focus, we want to remove anything that is a trigger for this individual who is escalating in behavior. This could be a person, it could be an object, it could be what you say, what you do. We need to remove any kind of trigger. Also, to promote safety, we want to follow crisis prevention procedures. So if you're familiar with programs like nonviolent crisis intervention or safe crisis management, you may have heard the following suggestions before. Stay calm and rational. Avoid power struggles. Take all threats seriously, no matter how old the kid is, no matter how big or small the kid is. Allow the student to vent. So if a student is yelling about something or someone, directed at you, directed at somebody near you, or just verbally releasing in general, it's in our best interest to stay calm and try to calm them as well. We might try to remove a student from a classroom in instances where he or she starts to become physically aggressive. In such situations, he or she is at a risk of hurting himself or other students. For any behavior that takes place during the acceleration stage, setting limits is always a good option. When setting limits, be sure to state them positively. For example, if a student is not completing his or her work during class, you could say to them, "If you finish your work on time, you'll be able to go to recess with everyone else." Stating choices positively usually gets through to those individuals in this stage of behaving irrationally. And when all is said and done, make sure you follow through with any limits you set. Otherwise, you will lose credibility with that student. And finally, and this might be one of the toughest of all, Disengage from the student and don't take it personally. When a person is in this acceleration stage, keep in mind he or she is not acting rationally, and therefore they may take out some of their frustrations on you without any reason at all. It's our job as professionals to try to help individuals figure out what their problems might be and how to deal with them. Because if they're acting out, they obviously don't know how to deal with their problems in a positive way or a constructive way. Stage 5 of the escalation model is the peak stage. Looking at the peak stage, we find ourselves as high as we can go in behavior intensity. At this point, the student is totally out of control physically and is exhibiting behavior that is very severe and possibly dangerous. When dealing with an individual in the peak stage, we should implement care to maintain safety at all times. Some of the behaviors you might see from someone in the peak stage include physical aggression, property destruction, self-injury, escape or social withdrawal, hyperventilation, verbal release or venting, along with many other behaviors that aren't listed here. Because of the nature and the severity of the behavior demonstrated in the peak stage, intervention is focused on safety. Therefore, crisis prevention procedures are an effective way to deal with the behaviors found in the peak stage. In the event that hands-on intervention is necessary, staff should be trained in a research-based approved program for doing restraints and personal safety techniques. Stage 6 of the escalation model is the deceleration or de-escalation stage. In looking at the deceleration, de-escalation stage of behavior, we find ourselves after the peak of intensity on a decline. However, this individual is still in crisis mode. At this stage, the individual might seem a little bit confused. However, the severity of the behavior is now on a decline. At this point, the student still might be a little upset, angry, or embarrassed, and therefore confused, so they socially withdraw. They're in denial, they might blame others, or they might act as though the problem wasn't such a big deal. Regardless, we need to deal with this student in a way that won't re-escalate his or her behavior, because at this point, it's quite possible to do so with ease if you're not careful. So as part of our intervention, we want to reestablish a line of communication with this student. However, we want to focus on removing excess attention. First and foremost, before talking to this student, make sure that you, as the professional, are ready to talk to this student, and make sure that the student is ready to talk as well. If either of you is not ready to talk, the conversation could go very, very wrong. While speaking with the student, avoid nagging or blaming that student for his or her actions. Don't force an apology from the student. They will apologize when they're ready. In some cases, students might not know how to apologize, so they might try to show you that they're sorry. We should be aware of this. We should also try to get to the bottom of why a student acted out. Sometimes they don't understand why they act out, and if we listen close enough, we might be able to help them. And finally, and I think this is one of the most important ones, emphasize starting anew. Let the student know that they do have the opportunity to do better in the future and that it will be recognized. If they think that there is no chance that they're going to be recognized for their achievements, they're not going to try very hard. They truly need to know that we're not giving up on them. The final stage in this escalation model is the recovery stage. Looking at the timeline and the behavior intensity, we find ourselves at the end of the timeline, and we also find ourselves at the lower end of behavior intensity. Needless to say, this individual is no longer in crisis mode and is starting to display willingness to participate in some activities. During this recovery stage, the individual may be showing a willingness to engage, but not with all people or groups of people, and maybe not in all activities. And although this individual might be trying to correct this problem, he or she still might not be sure of how to do it. So they're not willing to participate in all group activities or any group activities. They might go off on their own. They might fall asleep. However, they're trying to put their issue behind them. When intervening with someone in this recovery stage, our focus is to get them reestablished into routine activities. In doing so, we want to make sure that we follow through with any limits we may have set or any consequences for problem behavior. We also want to recognize any appropriate behavior that the student is demonstrating. Most of all, we want to talk with the student. In the recovery phase, the individual is ready to talk. This means that this individual is also willing to listen. And the purpose of this conversation is to talk it out, find out why this individual acted as he or she did, and find out better ways to deal with whatever may have triggered this person's behavior. By identifying triggers and the way situations were handled, staff and students could come up with more constructive, more positive ways of dealing with them in the future should these situations arise again. Now that we've gone over the stages of escalation and identified signs of a person who is escalating, as well as some possible interventions, it's time to look at some additional nonverbal and verbal de-escalation tips and techniques. When dealing with an individual who is escalated or in a process of escalating, we need to remember that the only behavior we can control is our own. We cannot make a child, we cannot make another person do something that they just don't want to do. If we remember this, we can avoid backing ourselves into a corner. For example, if a student pushes his book off of his desk because he's angry, we need to understand that this is irrational behavior and that this student might not comply when asked or told to pick up his book. A good way to handle this situation might be to calmly ask the student to pick up his book. If he doesn't, you might want to pick up the book yourself and put it on his desk. Further requests, yelling, or demanding could escalate the student and lead to a power struggle. Staying calm and understanding the student's stage of escalation is critical in this situation. In order to successfully de-escalate an individual, there are a few things we need to first understand. First, we need to understand that reasoning with an angry individual is not possible, and therefore our focus should be on reducing the level of agitation through the use of de-escalation techniques, both verbal and nonverbal. Additionally, we need to understand that de-escalation techniques are not inherently normal, and for this reason, some of us have to work a little harder than others in order to de-escalate an individual or a situation. Also keep in mind that our behavior as education staff can have an influence on how students respond to us when they're in one of these stages of escalation. For example, if we speak to a student in a raised voice or with an angry tone, there's a good chance that that individual will respond with an angry tone or with a raised voice. And in such situation, should we be surprised if we get that response? And by the same token, if someone speaks to us as adults in an angry tone or a raised voice, there's a good chance that as a knee-jerk reaction, we might respond to them with that same tone or the same raised voice. This is why we need to understand our role as the adults in the classroom. We need to act responsibly. We need to model appropriate behavior and use de-escalation techniques that won't further the escalation from this individual. We can think of it this way. Managing behavior is all about what we say and do. In other words, we have a big influence over the outcome of a situation where an individual is escalated. We have the ability to make things better or worse, depending on how we handle it. Looking at the picture in this slide, you can't teach children to behave better by making them feel worse. When children feel better, they behave better. And there's a lot to be said about that. By making a child feel worse, you're truly not getting through to them in the way that's going to help them. So how do we help the situations? Well, here are a few tips. Watch your body language. Are you crossing your arms? Are you rolling your eyes? What's your facial expression? And most of all, how is the student interpreting these things? Also, observe the student's body language when they're in one of these stages of escalation. Their body language can tell you a lot about what's going on with them. So part of body language, we want to keep in mind that most of our communication is nonverbal. Depending on what resources you use, you could see anything from 82% to 90%, 93%. Regardless, we need to keep in mind that most of our communication is nonverbal. And we also have to understand that from a very, very young age, people can read body language. Kids can read body language. So we need to be aware of our body language so as to not send a message that we're being confrontational or that we are angry or uninterested. Something else we need to consider, challenging postures. If you are nose to nose, toe to toe, eyeball to eyeball, if you're in someone's face, so to speak, you're too close to them. Being too close to them, being in their personal space, could raise their anxiety. When anxiety is raised, irrationality goes out the window. So we want to be careful of these challenging postures. We also want to avoid touching or poking these individuals, as well as pointing our fingers at them. We should especially avoid pointing our fingers at another person's face, as this has the potential to raise anxiety and possibly escalate the situation further. Some body language tips. Respect personal space. Everyone has their own comfort zone, their own personal space, and it's typically about 1.5 to 3 feet away from that person. When we get within that comfort zone for a person who is escalating in behavior, we could raise their anxiety, therefore make a situation worse. So we want to avoid getting into that personal space. There are a lot of things that determine a person's personal space as well, how close they want or would allow you to get to them. Things such as a person's size, a person's height, maybe a person's expression on their face, or even how familiar you are with that person. These things all affect personal space. While speaking with an individual who's escalating, stand at an angle, not shoulder to shoulder. When you stand shoulder to shoulder with an individual, it could be taken as being confrontational or challenging. And again, we want to avoid confrontational gestures, such as pointing, hands on our hips, closed fists, things of that sort. Paraverbals. It's not what you say, it's how you say it. When we speak with someone, our tone, volume, cadence, and inflection all send a message in addition to the actual words that are being said. When we talk about tone, are we using proper tone? Are we sounding like we're angry? Are we sounding like we're being sarcastic? We need to use a tone that will reduce anxiety and aggression. And if we listen to a student's tone of voice, it should be an indicator of how they're feeling. When we talk about volume, are we using the proper volume when we're speaking to an individual? Are we too loud? Are we too soft? And by the same token, when we listen to the student talk, are they talking too loudly for the situation? Are they talking too softly for the situation? When we look at cadence, we're talking about the rate of speech. Are we talking too fast? Are we talking too slow? If a student is talking fast, it could mean that he or she is excited or even scared. Same with talking too slow. Same thing. The student could be scared or upset. Paying attention to cadence definitely can give us an idea of what a student is thinking or what stage they're in. And finally, we talk about inflection. Inflection is a change in the way you say something, where you put the emphasis on certain words. For example, if we take the word seriously, if we put the accent at the end of the word and we say seriously, It's as if we're asking a question. But if we change the way we say it and we put the emphasis at the beginning, we say seriously. That changes the word as if to mean you're disgusted with something. So it does change the meaning of the word when you put the accent in different places. So let's take a look at some nonverbal techniques. I've been saying all along that staying calm is very important, and it is. Staying calm is contagious, just as chaos is. So stay calm with a student who's escalating, even with parents or coworkers who are escalating. Stay calm. It's contagious. If you're staying calm and a student's trying to get a rise out of you, trying to get you into a power struggle, they will eventually end up seeing that it's not going to work, because you really can't have an argument with someone who's not arguing back. Maintain eye contact. Now I put limited in parentheses because eye contact is important, but if you have too much eye contact, sometimes that could be taken as aggression or confrontational. Maintain a neutral facial expression. Students will look at our facial expressions and they will act upon that if they think we're disappointed with them, if they think we're angry with them. Maintain an alert posture and show interest. Students want to know that we are paying attention to them and that we care. And this definitely helps in reestablishing a communication with these individuals and getting them to talk. And perhaps most importantly, know your surroundings and position yourself for safety. If an individual is really upset and there's a potential that they will physically act out, we want to keep ourselves safe as well as that student and any other bystanders. And finally, we're going to look at some verbal techniques. When thinking about using verbal techniques for an individual who's in a stage of escalation, we need to remember that that individual may not be thinking rationally and they may be saying things that just don't make sense or don't fit the situation. So one of the things we want to do is not focus so much on the content of what they're saying, but focus on calming them. And again, we want to use a calm, soft, slow, and low tone of voice so as to not escalate the situation. We want to avoid interrupting the student while talking. Give them their chance to talk. Don't try to talk over them, because this could just cause yelling, screaming, or again, escalation. Avoid being defensive. Just listen to what the student has to say. They might throw a few jabs in on us, but listen to what they have to say, and again, disregard that content. Respond selectively. Respond to key things that the student says, things that will help to calm the situation. Be honest. In other words, don't make any promises to this child that you cannot keep. Be honest. Understand and empathize with feelings, not the behavior. In other words, if the student is saying that he's angry with the world and he wants to punch Jimmy in the face, let that individual know that it's okay to be angry, but it's not okay to punch someone in the face. Avoid arguing with that student. Again, while this individual is in a stage of escalation, he or she is not going to be rational, and it's going to be difficult to get through to that individual, and stay out of those power struggles as well. This concludes our presentation on the stages of escalation. And again, I want to thank you for joining us.